Hey, Health Protocol fam! Ever woken up with that sudden, sharp back pain that makes every single movement feel like a mountain? Or maybe you've heard whispers about slipped discs and wondered what on earth that even means? Well, today, we're tackling a topic that impacts millions: spinal disc problems. We'll demystify these often painful conditions, explain what's going on inside your back, and give you the vital information you need to understand and protect your spine. Let's get into it. Imagine your spine as a magnificent, flexible tower of bones. Between each of these specialized bones, called vertebrae, sit incredible, rubbery cushions. These are your spinal discs, or as doctors call them, intervertebral discs. They're about an inch across and a quarter-inch thick, small, but mighty. Each disc is like a tiny, tough capsule. It has a strong, fibrous outer layer, almost like a protective tire, called the annulus fibrosus. Inside this tough exterior is an elastic, gel-like core known as the nucleus pulposus. These discs are firmly anchored between your vertebrae, held securely by strong ligaments and surrounding muscles. There's really not much room for them to slip or move out of place, despite that common saying. The parts of your vertebrae that actually allow for movement and prevent excessive bending or twisting are called facet joints, which protect your delicate spinal cord and the vital nerves running through it. Now, while discs are often described as shock absorbers for your spine, that description can be a bit misleading. In children, they're more gel-filled, but as part of the natural aging process, they begin to solidify. By early adulthood, their blood supply diminishes, the inner material hardens, and they become less elastic. By middle age, your discs are quite tough, almost like a piece of hard rubber. These age-related changes make their protective outer lining weaker, leaving them more vulnerable to injury. So, what happens when a disc runs into trouble? Under stress, the disc's inner gel-like material can swell and push outwards through its tough outer membrane. This can cause the entire disc to bulge or become distorted. If there's an injury or a weak spot, some of that inner core material might even protrude right through the outer casing, pressing directly against nearby nerves. If the membrane tears or ruptures, the disc material can extrude further, putting pressure on the spinal cord itself or the nerves that branch out from it. This is what we call a herniated disc, and it can lead to excruciating pain. Initially, you might experience severe muscle spasms in your back or neck, drastically limiting your movement. If nerves are affected, that pain can shoot down into an arm or a leg, often described as sciatica when it goes down the leg. Interestingly, the vast majority of disc injuries occur in the lumbar region, lower back, with only about 10% affecting the upper spine. It's also important to know that not all herniated discs cause pain. Some people have deformed discs with no discomfort at all. Herniated discs are most common in people aged 30 to 50, though even active children and young adults can experience them. Older individuals whose discs have largely solidified are less likely to suffer this specific problem. What can help? Regular, moderate exercise is a fantastic preventative measure as it helps maintain flexibility. Keeping a normal body weight also significantly reduces strain on your spine and discs. While a sudden, violent injury can certainly damage a disc, surprisingly, problems often arise from the normal aging process combined with everyday activities. Simple actions like lifting heavy objects incorrectly, twisting awkwardly during a tennis game, or even a sudden slip and fall can cause the disc's outer layer to break or distort. This is especially true if the disc material then presses on a spinal nerve. Sometimes, a disc can swell, tear, or even degenerate without any obvious cause, which can be baffling but still requires attention. Degenerative disc disease. It sounds a bit intimidating, doesn't it? But it's crucial to understand that, at its core, this isn't necessarily a disease in the way we think of an illness. Instead, It's often a natural part of the aging process. Just like our hair naturally grays, our skin develops wrinkles, or our joints might get a bit stiffer as we get older. Our spinal discs also undergo changes. As years pass, the once flexible, gel-like core of our discs gradually dries out and hardens, and the tough outer casing can weaken. This leads to a natural, gradual loss of flexibility in the spine. It's simply part of life's journey. However, for some individuals, this disc degeneration can become much more severe or problematic than for others. Why does this happen? Well, several factors can significantly accelerate this wear and tear and place undue stress on your spine. When the muscles supporting your spine, especially your core muscles, aren't strong enough, your discs have to work harder and absorb more shock. This extra strain can speed up degeneration. Consistently slouching, hunching, or maintaining incorrect posture, whether you're sitting, standing, or lifting, puts uneven and excessive pressure on your discs. Over time, this can deform them and break down their structure. Carrying extra body weight, particularly around your midsection, places immense and unnecessary strain on your lower back discs. It's like constantly carrying a heavy backpack, even when you're just standing still. This constant compression significantly accelerates the degenerative process. When these factors combine with the natural aging of your discs, it can lead to more pronounced pain, stiffness, and even nerve issues. So, while some degeneration is inevitable with age, paying attention to muscle strength, posture, and weight management can play a huge role in supporting your discs and keeping your spine healthier for longer. You know, when we talk about managing conditions like degenerative disc disease, our minds often jump straight to exercises or physical therapy. But what if I told you that one of your most powerful tools might already be in your kitchen? That's right. Nutrition plays a much bigger role in spine health than many people realize. Making smart food choices can significantly impact your comfort and well-being. So, if you're looking to support your spine and help manage degenerative disc disease, here are some fantastic foods you should consider adding to your daily routine. Whole grains. Don't underestimate the power of whole grains. They're not just about fiber, though that's a huge benefit. Whole grains are packed with essential vitamins and minerals that are crucial for overall health, including the intricate structures of your spine. Studies consistently link them to a lower risk of serious issues like heart disease, diabetes, and even certain cancers. When you're at the grocery store next, grab some whole oats, whole grain bread, quinoa, or brown rice. Your body and your back will thank you. Leafy greens. If there's one group of foods that truly deserves superstar status, it's leafy greens. These vibrant powerhouses are loaded with vitamin K, a nutrient vital for bone health and protecting against conditions like osteoporosis. But that's not all. They're also champions at fighting inflammation throughout your body, which is incredibly important when dealing with disc issues. Think spinach, kale, Swiss chard, and cabbage. Make them a staple in your meals. Blend them in smoothies, sauté them as a side, or load up your salads. Fruit. Who doesn't love fruit? The sheer variety is incredible, and every single one offers a unique blend of essential nutrients that contribute to a healthy body. Whether you pick the zesty tang of grapefruit, the antioxidant punch of blueberries, or the unique goodness of pomegranates, you're making a fantastic choice. Fruits provide natural sugars along with vitamins, minerals, and fiber, helping to maintain your body's vital functions and support healing. Healthy fats. The omega-3 advantage. Not all fats are created equal. We're talking about healthy fats here, specifically those rich in omega-3 fatty acids. These incredible fats are well known for their protective benefits for your heart and brain, but they also play a significant role in managing inflammation throughout the body, a key factor in disc discomfort. Excellent sources include salmon and other fatty fish, walnuts, flax seeds, chia seeds, and certain oils like olive oil. Adding a dollop of plain, unsweetened yogurt can also be a good source of healthy fats and probiotics. Lean protein. Lean protein is absolutely essential for building and repairing muscle tissue, which in turn supports your spine. But it also plays a crucial role in regulating your blood sugar levels. When your blood sugar is stable, you're less likely to experience those sudden cravings for sugary, unhealthy snacks that can lead to poor food choices. Incorporate foods like turkey, chicken breast, beans, lentils, and eggs into your meals to provide a solid foundation for your diet and help keep those unhelpful cravings at bay. Taking charge of your nutrition for degenerative disc disease can feel like a big step, but it's entirely within your control. A helpful strategy is to create a weekly meal plan. This allows you to intentionally plug in these beneficial foods each day and ensure you're getting a consistent intake of nutrients. While it's important not to be overly strict or feel deprived, try to cut back on added sugars and focus on making consistently healthy choices. The goal is to fill yourself up with nutrient-dense foods so you're not left feeling vulnerable to less healthy temptations. Your nutritional choices are a vital part of your responsibility to yourself and your spine's long-term health. So, there you have it, a deeper dive into spinal disc problems. Understanding how your discs work, what can go wrong, and the common causes is the first step toward better spinal health. Remember, pain is a signal. Listen to your body and take action. If you've experienced these symptoms, always consult a healthcare professional for proper diagnosis and guidance. What's your biggest takeaway from today's discussion? Share your thoughts in the comments below, and don't forget to like this video.